Hi, my name is Capri, and this is part 2 on how to teach your patient how to self-administer Lovenox. It is at this time that you are ready to teach your patient after you've given them instruction. Again, teach them to cleanse their hands properly with soap and water, or they can use an alcohol-based product. So I will use Purell, and I'm going to simulate this. When patients are self-administering Lovenox, they do not have to put gloves on. If a patient has a family member who is going to self-administer Lovenox, it is suggested that they place gloves on as prophylactic coverage for any possible bloodborne pathogens. So I will take my gloves if I am going to teach them, because of course the first time I don't expect them to self-administer it, but it's subsequent times that it's very important for them to do it in front of the nurse. So I've donned my gloves. This area is going to be my simulated abdomen, and my belly button is right there in the center. I will take an alcohol swab, and then I will cleanse that area in a circular motion, starting from the inside out. I have selected the area that I will pinch an inch. I'm going to prepare my needle. There is a rubber tip at the end that is covering the needle. I am going to take my finger and pull it outward, exposing the needle. Pinch the inch, go in at a 90-degree angle directly into the skin. I will push the plunger down into the abdomen. When the medication has completely entered into that area, I will pull the needle out, unpinch the skin, holding the syringe downward. I am going to push the rest of the plunger downward until it meets the base of the needle, of the syringe, which will release the safety sheath. This will be placed into a needle box or into a soda bottle, where it can then be kept out of reach and then exposed of properly. It is at this time that you ask your patient, do they have any questions? And then you instruct them that in the next 24 hours, if the medication is ordered that way, and that's the way it is most likely ordered, that you will walk them through it. You will be there with them. You will encourage them to ask questions. You will encourage them not to rub the area where the medication has been administered, because it can cause bruising in that area. Also, you will encourage